Hello, my name is Alex Schadenberg. I'm the Executive Director of the Euthanasia Prevention Coalition. And I'd like to talk to you today a little bit about what's happening in Canada and under the basic message of really do not follow Canada's lead on the euthanasia assisted suicide issue. I'm the Executive Director of the Euthanasia Prevention Coalition, and I've done this role since 1999. Basically speaking, Canada legalized euthanasia in 2016. We were successful in defeating euthanasia bills before that point. There was a bill in 2010, which we defeated by a vote of 228 to 59. But then the courts got involved, and we had a terrible time after the courts got involved because everything then changed with the direction of the issue. We must continue, though, to tell people what the legislation does and how it does it. And we must work with people who care. We must expose the truth by helping people find, and we must distribute stories. And this is part of what I'm going to do today to encourage you not to follow Canada's lead. Canada legalized euthanasia and assisted suicide in June of 2016. Since then, Canada has already passed legislation, Bill C7, which passed on March 17 this year, to expand the legislation, even though Parliament had not done a 5-year review of the law, which was required by the original legislation. The expansion of Canada's euthanasia law, Bill C7, was based on the Quebec Truchon court decision, but in fact it went much further than Truchon. So what the Quebec Truchon court decision was, is it was a case of two people with disabilities in Quebec. Their names were Gladue and Truchon, and they brought the case to the Quebec court saying that because they were not terminally ill, therefore they did not qualify for euthanasia, and they said that they found that to be unconstitutional, and they asked the court to strike down that part of the law. And in this case, the Quebec Superior Court struck down that part of the law. The federal government never appealed the decision to the Court of Appeal. It never went to the Court of Appeal, never went to the Supreme Court of Canada. Now, I'm going to present you some Ontario data because the national data is very, very slow in being shared with the world or Canadians. So the Ontario data is important because Ontario releases this data on a monthly basis, and it represents 39% of Canada's population. Ontario does not have the highest rate, though, of euthanasia in Canada. That is in British Columbia. According to the reports of the Office of the Chief Coroner of Ontario, there has been 7,549 reported assisted deaths since legalization, which was June 30th of 2016 to April 30th of 2021. And there was 853 reported assisted deaths in the first 4 months of 2021 alone. So you see that there's a great growth of euthanasia going on in Ontario alone. Just to give you the data, there was 7,547 euthanasia deaths and 2 were assisted suicide. That's a whole nother presentation as to why that exists that way. The number of assisted deaths in Ontario has been continually increasing. There was a 33% increase in 2020 alone, with 2,378 assisted deaths in Ontario alone. There have been 1,789 in 2019, et cetera, et cetera. So the numbers have taken off. COVID was one of the reasons why we had a 33% increase in 2020. In July 2020, Health Canada released its first annual report. Now let's look at this question. How come Health Canada released its first annual report in July of 2020, knowing that we legalized in June of 2016? The data came from the reports submitted by physicians or nurse practitioners who had caused the death. That's how the law works. The doctor or nurse practitioner who approves the death is the same one who can then carry out the death, is the same one who's then required to send in the reports. It is what you call a self-reporting system, similar to the Netherlands and Belgium. That type of a system is what exists in almost every jurisdiction in the world, and that type of system leads to abuse of the law. There's no requirement that a third party or neutral person examine or submit the reports. The data from the report indicates that in 2019, there had been 5,631 reported May deaths in Canada. I say reported because according to the Quebec data, there were some unreported deaths, but of course the Health Canada report didn't in any way deal with anything like that. Okay, it doesn't in any way uncover that. So according to the Health Canada report, there have been 13,946 assisted deaths reported in Canada from legalization until December 31st, 2019. I estimate that we are currently now at 24,000 assisted deaths as of April 30th of 2021. and it's based actually on the Ontario data that I come up with that. But we legalized Bill C-7 already. We didn't even review the original law. So we expanded our law without even doing a review. And in fact, the legislation, the original legislation, required a fulsome review of the law, not just a review of the possible expansions of the law. Bill C-7, what did it do? It removed the requirement of law that a person's natural death be reasonably foreseeable in order to qualify for assisted death. So that was the terminal illness requirement. Now the point is that term, natural death be reasonably foreseeable, was never defined in the law. Because it was never defined in the law, it was never being applied equally anyway. Nonetheless, the Quebec court decision actually only required this amendment to the law. Bill C-7 went much further. Bill C-7 permitted a doctor or nurse practitioner to lethally inject a person who was incapable of consenting, if that person was previously approved for an assisted death. I think this contravenes the Supreme Court of Canada Carter decision. So what the Bill C-7 said is that if you have been previously approved, if you become incompetent before actually dying by euthanasia, they can go ahead with doing it anyway. The previous legislation said you had to be competent at the time of death. Bill C-7 created a two-track law. So it said that because the natural death being reasonably foreseeable was struck from the law, it said that if a person's natural death is deemed to be reasonably foreseeable, meaning they're deemed to be terminally ill, however that's defined, because it's not been defined, there would be no waiting period. You can die on the same day, a same-day death. It's very dangerous to have a same-day death. But if the natural death was deemed not to be reasonably foreseeable, meaning that someone actually isn't dying, but they have conditions which are, painful, grievous, irremediable, then they would have a 90-day waiting period before being killed by lethal injection. I'm not going to get into the constitutionality of that question, but I consider this to be a serious problem in Canada, this two-track law. Bill C-7 also legalized euthanasia for people with mental illness alone, but the government created a 2-year type of waiting period on this because it needed to create the protocols for killing. And I'm not going to get into the politics of how this occurred because originally the legislation, Bill C-7, didn't include that, and the Senate amended it and government accepted that. And that's a long story. We're not going to go there. Further concerns. Canada's approved euthanasia for people with mental illness alone. Now, there would then likely be a 90-day waiting period because there aren't protocols established yet. Because the law already says that if you're not terminally ill, then there'd be a 90-day waiting period. But it is unlikely to require that person to at least try effective treatment. And the reason for that is the current law does not require someone who's approved for euthanasia to try effective medical treatments. So what that means is if you had a medical condition which was either terminal or chronic, but you did not want to try medical treatment, you do not consider that acceptable, you would not have to, even if those treatments would be effective. Okay, the protocols in the Netherlands and Belgium concerning euthanasia for mental illness suggest that there be a 1-year waiting period, and the person is expected to try all effective treatments. In fact, the protocols in the Netherlands and Belgium suggest that if someone is not willing to try an effective treatment for their condition, that they in fact then don't qualify for euthanasia. The Canadian law is unlikely to have that, knowing that the law already says you do not have to try any treatment. I'll give you some stories. Well, in August of 2016, Candace Lewis, who was 25, who was born with multiple disabilities, was pressured by a doctor in Newfoundland to ask for an assisted death. Candace was very sick and receiving treatment. The doctor asked her mother if she knew that assisted death was legalized, and her mother said no. The doctor said that he supported assisted death and he wanted to help her. The doctor was told that they weren't interested in assisted death. The doctor told her mother that she was selfish, and then he challenged Candace by saying, "Do you know how sick you are?" What ended up happening in this situation is Sheila, Candace's mother, Sheila is beside Candace. Sheila brought Candace home because she was told by the doctors that Candace was dying, that she was terminally ill. We need to help you with an assisted death. So Sheila brought Candace home. Candace actually recovered. Now, I'm not suggesting, of course, people always recover. What I'm saying is that was the end result of this situation of being pressured to have euthanasia. Roger Foley, who lives with cerebral ataxia, he launched a lawsuit in August of 2018 against the healthcare system in Ontario when the hospital offered him MAID, euthanasia, but would not provide him with assisted living. So what happened is Roger Foley was in the hospital, but he had applied for one of the programs we have in Ontario is called self-directed care. He had applied for self-directed care because the reason he was in the hospital was that his caregivers had accidentally poisoned him. And another time, one of the caregivers had left for their shift, and had left the gas stove on. And he's like, I can't, my life depends on having caregivers that I hire that I can trust. So in Ontario, we do have this program, and Roger Foley was turned down for self-directed care. So he had actually refused to leave the hospital until he received self-directed care. The hospital, providing us care, gave him the choice of paying $1,500 per day to stay at the hospital or to have euthanasia. Those are the two options he was given. He actually was given self-directed care. He made enough of a stink about it that he was, and the media got on his side, that they did give him self-directed care. In August of 2020, Isabel McKenzie from British Columbia, a seniors advocate, reported that some nursing home residents in British Columbia had requested an assisted death based on social isolation related to the COVID pandemic. In November 2020, Ontario long-term care resident Nancy Russell requested and died by euthanasia because she wanted to avoid another COVID-19 lockdown. The story referred to Russell as a social and spry person who suffered during the first lockdown. She had other health-related issues, but she was not terminally ill. She was not dying, but she died by euthanasia and was approved for euthanasia because she wanted to avoid another COVID-19 lockdown. What else do we have in Canada? Trampling on conscience rights. The BC government defunded the Delta Hospice Society on February 24th, 2021, because they refused to kill their patients by euthanasia. They also expropriated, the BC government also expropriated the 10-bed hospice of the Delta Hospice Society. In Ontario, when asked for euthanasia, doctors must provide an effective referral for euthanasia. An effective referral is defined as a referral for the purpose of the act. This requires conscientious objectors to be involved in the act. Doctors who are not willing to kill their patients are also not willing to send their patients to the killer, because that's what an effective referral means. You have to send them to the doctor or nurse practitioner who's willing to do the act. Kelly Block, an MP, has introduced Bill C-268 in our federal government parliament to protect conscience rights for healthcare professionals, and it's going to be debated in May, this month, May of 2021. Dr. Joel Zivit told Canada's Senate committee. Now, Dr. Joel Zivit is a Canadian physician who works in the US as a physician, as a researcher, and he told Canada's Senate committee that research shows that based on the drugs used for euthanasia, death by euthanasia and assisted suicide is actually a death that is similar to drowning. The drugs used will paralyze the body and make it impossible to breathe, but they do not block the sensation of pain. They cannot struggle because they are first paralyzed. So if you look at how euthanasia is done, it's done with a 3-drug system. They give a drug that prevents the person from throwing up. They give another drug to paralyze the person. And the reason for that is because it prevents the person from going into convulsions. And then they give a 3rd drug, and they always told us that drug was to shut down the heart. But in fact, Dr. Joel Zivit says in his research that clearly it doesn't do that. That type of drug doesn't do it. In fact, what it does is it causes the lungs to fill with fluid, and the person dies of a death similar to drowning. And they say, well, this looks like a peaceful death. And he says that it may appear like a peaceful death, but you cannot say that because you've paralyzed the person. They cannot complain. They cannot respond. He says autopsies show that the death is caused from the lungs filling up with fluid. Fighting euthanasia and assisted suicide. We need to call it what it is. It's very important. The other side wants to call it death with dignity. They want to call it a type of a medical treatment. They will say, the medical drugs. No, these are lethal drugs. This is killing someone by lethal drugs. Using terms such as aid in dying, physician-assisted death, doctor-prescribed death. It doesn't help us. It doesn't help us. We oppose these laws because they allow one person to be directly and intentionally involved with killing or assisting the suicide of another person. Euthanasia is killing, lethal injection. Assisted suicide is prescribing the lethal drugs for the purpose of that person dying by assisted suicide. And creating exceptions to homicide or manslaughter are bad ideas. These are bad ideas in law. This is what they did in Canada to legalize euthanasia. They created an exception to homicide. So if you want to find our Euthanasia Act in our criminal code, you look to the criminal code under homicide, and you'll see the exceptions to homicide are assisted death, medically assisted death. Note, the term aid in dying is used for both euthanasia and assisted suicide. Focusing on palliative care is not a good strategy. I know a lot of physicians are watching this. They're going to say, what's he talking about? Obviously, the purpose to focus on palliative care is to say that euthanasia is not necessary. Well, assisted death euthanasia advocates also support palliative care. The difference is that they don't have a problem with killing. So when you're talking about palliative care, you're going to be undercut in your argument because the other side will say, well, we want palliative care. We urge you to have more palliative care and better palliative care. We support that. But we also think there should be one more choice for that one time, for those very few conditions when somebody cannot be properly cared for by palliative care. Focusing on palliative care also causes us to focus on pain and symptom management issues. And that's our enemy actually in this debate. Even though palliative care can be excellent, no one wants to experience pain or distressing symptoms. In fact, people are dying by euthanasia not because they are in pain. If you look at the data, very few people actually ask for euthanasia because they're in pain. Usually it's because they're going through this difficult health condition, but they're emotionally, psychologically, and sometimes existentially suffering. They're going through this difficult time. They're wanting to avoid future suffering. That doesn't mean they're currently suffering physical pain. Now, I'm not saying nobody is suffering physical pain who asks for euthanasia. What I'm saying is that is the minority of the cases. That's a small number of the cases. Usually it's because they are going through a feeling of hopelessness. They feel that their life lacks value or purpose or meaning, and they want their life to end because they're afraid of a bad death. Focusing on palliative care doesn't actually help us then, because we can say, oh, you can have a good death. And then we talk about relieving pain and symptoms, and their attitude is, I don't even want to go through those pain and symptoms. You may say that's unrealistic, but I'm talking about human reality. People don't want to suffer, and therefore they say euthanasia and assisted suicide is a way out of the suffering. So, juxtaposing palliative care to euthanasia doesn't work either. The other sad thing is once we've legalized euthanasia in Canada, a lot of our palliative care institutions have shifted. Whereas they originally fought against euthanasia and they were fighting with me, many of them have shifted now, and now they provide euthanasia. And I'm not saying that that there's anything good about it. I'm just recognizing that the shift in the culture has happened, and it was because there were too few people who recognized that palliative care should have nothing to do with euthanasia. In fact, now our governments are making it part of euthanasia, palliative care that is, based on the funding model. We need to focus on what assisted suicide and euthanasia are, not why it's unnecessary. What is it? Focus on that. It's about killing. It gives the physician the right and law to cause your death. We must work with people from all political points of view. There's not one silver bullet to prevent the passage of a euthanasia or assisted suicide bill. There's many different arguments that will affect people in a different way. People with disabilities have a personal experience that need to be heard by politicians. People with disabilities are our canaries in a coal mine, so to say. They've experienced many issues dealing with medical treatment. Not all physicians are caring physicians. Not all physicians believe in the sanctity of human life. In fact, sadly, today, most of them don't actually believe in the sanctity of human life. Therefore, people with disabilities have often experienced a very crass response to their medical needs. And it needs to be heard because, of course, when euthanasia is legal, that further and extends to the effect of the care of people with disabilities. We must encourage people to work together, but never discourage people from working on their own. I've been part of way too many campaigns where people shut down someone because their message is different. So you're saying their message isn't important. Well, I'm not saying that there shouldn't be a key message, or there shouldn't be key leaders. What I'm saying is there's no one silver bullet that's going to win this for us. Like the Netherlands and Belgium, Canada is debating the expansion of euthanasia to children, to incompetent people who made an advance request, to people who are incompetent with Alzheimer's, dementia, and to people with mental illness. It's crazy how fast we've gone in my country, so fast to expanding the laws. There's only one clear line. That is the prohibition of killing. And what's your line in the sand? If the line in the sand is we shall never kill, That's what we're focusing on. Once killing is considered an acceptable solution to human problems, the only remaining question is who can kill and for what reasons? Euthanasia Prevention Coalition, you can contact us. I have the largest source of information on euthanasia and assisted suicide in the world. If you go to my blog, if you go to my website at epcc.ca, you can then link to my blog by just looking at the picture of me on the website and click on it. It brings you to the blog. It has thousands, literally thousands of articles on euthanasia and assisted suicide, research articles. Many of them will provide you great information. We need to oppose euthanasia and assisted suicide by calling it what it is. And I wish you all the best, because we're depending on making sure for your nation that you do not legalize euthanasia and assisted suicide. Thank you.